stage that will impact nearly half of the world's population at some point. However, for many, this natural process can be a time of anxiety and distress because of the challenging symptoms that come with it.
Now, lots of you have been sending in your menopause questions, and here to answer as many as we can get through is GP and menopause specialist with menopausehealth.ie. It is Dr. Caoimhe Hartley. Caoimhe, thank you so much for joining us today on the show, because we've talked about this before. We're going to be talking about it again. Half the population, all of us, it's something we're going to go through, and the misinformation out there is somewhat still a bit staggering.
It is, and I think it's so important to be talking about this and to be educating women.
Yeah, and
hopefully answering questions as we go along.
But it's one of those things, because I'm at a point of my life, like I'm 41, and to me, menopause just doesn't seem to be in my realm. There's nobody saying, or there's nothing coming at me going, here's, because we were chatting just before we came on air, and I'm like, am I at a point? Am I not at that point? I think women sometimes don't feel maybe that it's something that should be in front of, or something they should be investigating in, because they don't think of age that it's there, but it comes from the early 30s.
It can be, but for some people, there is a list of symptoms that we can look out for and maybe mindful of. So we'll just go through those first, perhaps, the symptoms and signs to look out for.
Yeah, so unfortunately, they're kind of head to toe, but hugely individual. And for some women, it's mostly mood and emotional symptoms. They might have depression, anxiety. They might find that they're increasingly irritable. For women in their 40s, women who are perimenopausal, so these are women who are still having periods, and they're not the kind of classic, well, my periods have stopped and I'm getting hot flushes and night sweats. They might find it's almost like PMS type symptoms, but worse.
Yeah.
So we see other physical symptoms. We see breast tenderness. Some women get bloating. We can see dry skin, dry hair, joint aches and pains. Obviously, hot flushes and night sweats, I think a lot of people are familiar with and have heard of. And then there's the genitourinary symptoms. So vaginal dryness. We see urinary incontinence or needing to pee more frequently. Recurrent urine infections can become really common as well. So it's head to toe.
It is head to toe, literally head to toe. And it's exhausting because the misdiagnosis often happens, misdiagnosed for symptoms of anxiety, of depression, and things like that, when balancing your hormones could really fix it.
Yeah, we think women are probably 3 to 4 times more likely or more vulnerable to depression and anxiety as they go through menopause, so it's definitely something to consider.
Yeah, we have a lot of questions here, so we may as well run through as fast as you can. Maria says, I'm 46, I still have no symptoms. Would you recommend doing and taking anything specific in the time approaching menopause?
So a good time to look at your overall health, maybe look at diet, nutrition, your exercise, activity, consider vitamin D for a lot of women, for bone health. In terms of something like HRT for this lady, it really comes down to how symptomatic she is. And if she feels she can manage her symptoms without taking anything, then keep going. Then there's no indication for hormone therapy unless her periods have stopped and she is a post-menopausal woman. So we know for younger women under the age of 50 who have stopped having periods completely, they have no estrogen anymore, they're at risk of developing a loss of bone density, and there's cardiovascular disease to be considered too.
And that is an important distinction because of the difference between taking a hormone replacement therapy when you're younger and older. For the normal progression of menopause, people were presume it completely stops, the period would stop in the 50s, but for some people like myself, I was perimenopause and I had ovarian failure in my early 30s, so I had to go on HRT quite quickly, and if I didn't, there's serious health side effects to not doing so.
Absolutely, yeah. For women over 50, and the average age of menopause is about 50, 51, that's the average age for your periods to stop. They choose to take HRT because for symptom control, maybe some health impact as well, for bone density, etc. But for younger women, the evidence is very clear that the benefits will outweigh the risk for younger women, especially when it comes to health.
Yeah, because you're just storing down problems for yourself down the line in terms of osteoporosis and everything else.
As we have this conversation, there's just so much to navigate. I know we said in the top line about it causing anxiety and distress, but it is for women. It's when you start to face into it and look at it, it is quite anxious time. So it is good to have a little bit of information about it. Mary texted and say, what can help with bloating in menopause?
Okay, so
God, we're going through all the misery that we have to go through, fellas. That you don't have to. I'm not bitter at all. Anyway,
we all relate, and bloating is really common, and it's often cyclical. So it might be something related to your periods, just a couple of days before you get your period, but I would sort of remind people, look, if you're getting something like bloating and it's new and it's, you know, something you haven't had before, it's more severe, maybe consider popping into your GP and getting checked. Other things can cause bloating. It can be hormonal. Something like celiac disease can cause bloating.
It's very common in Ireland.
It is, yeah, absolutely. And it can happen at any point in your life that you can develop celiac disease. Irritable bowel syndrome, so your diet, nutrition, other things need to be looked at. But for some women, it's a sign of perimenopause too.
Agnes says, I've been to my doctor, I've been prescribed HRT. I'm anxious already and even more anxious about starting the prescription in case it doesn't work out. Is it difficult to stop taking HRT down the line, or is it a prescription for life? That's what a lot of people think. You're on it forever. You're not.
No, that's an individual thing.
Yeah.
Absolutely. That depends on the person. For some women, they continue to get benefit from hormone therapy for the rest of their life. So thankfully, the old-fashioned approach of saying, look, you get 5 years and then we have to take it away from you, or you get to 60 and we've got to stop it, that's gone. And we're now letting women make that decision themselves. But you can stop HRT at any point, yeah.
And the support is there as well.
Absolutely,
like,
yeah.
Again, talking to your GP. Michelle texted in, most of the symptoms are gone and eased, but I still have no interest in sex. I'm only 49. I'm married. My husband is really fed up with no sex. I'm on patches 4 months now. Is there an average of how long it takes for my libido to return?
Ooh, that's a really tricky one. And libido itself is really complex. So, you know, other factors like sleep, your mood, what's going on in your life. And then look at kind of vaginal issues. So dryness, painful sex can contribute to your relationship with your partner, how much stress you have. All these other factors, I think, all contribute to libido. So it's very hard to kind of put a timeline on it and say, you know, oh, well, in a year you'll be better. But we do have other things that help. And for women who are already on estrogen, it's worth looking at something maybe like testosterone. There's a small bit of evidence for using that for improving sex drive.
So that it's not GP. Yeah, you do have to, because you might need progesterone patch, depends on the patches. Maybe you need a little bit more estrogen. It's not one size fits all. It's if you're only on it 4 months, it is trial and error to see the right dose for you.
And that's still early days, so 4 months too. You know.
Now, Tanya says, how do you spot estrogen dominance if on HRT during perimenopause? Now, what in the name of God is estrogen dominance? Because I've never heard of that.
Yeah, it's not a term that I would use. It's not really a medical term. But I think, you know, we know that through perimenopause, it's kind of different to being postmenopausal. In perimenopause, your ovaries are producing fluctuating amounts of hormones.
So it's up and down like a yo-yo, basically.
Totally. It's not that you're deficient in estrogen. You're still having periods. And at times, you're actually overproducing this hormone estrogen. And that's what drives a lot of things like bloating and breast tenderness and headaches. So estrogen dominance isn't a term I would use, but you can have too much estrogen at times, and headaches and breast tenderness, they would be the main symptoms.
So Margaret texted in here as well. I've been going through surgical menopause since 2007. I've tried everything to get relief from the hot flushes, night sweats, lack of sleep. Nothing helps. The symptoms would have gone by now, but unfortunately not. Any advice?
2007, crikey.
It's a long time.
Isn't it? Yeah.
But surgical menopause, it'd be interesting to know a little bit more about that, whether the surgical menopause is perhaps because of breast cancer in the BRCA gene or something like that. If your ovaries are taken out and your breasts are removed, you can't go on. Can you go on HRT?
You can, actually. If you're under the age of 50.
And you have that gene, you can?
You can, yeah. Okay. If you've had a bilateral oophorectomy, which is a fancy way of saying you've had both of your ovaries removed. And the reason is we don't think we're undoing the good work and the kind of the benefit, the health benefit from having your ovaries removed in terms of breast cancer. By giving younger women under the age of 50, by putting them on HRT, we're actually protecting their bones in their heart. In this case, surgical menopause is a tough thing to go through.
It's literally diving off a cliff with no warning.
Absolutely. And instead of going through this kind of fluctuating time, you're just, you know, you're off a cliff with your hormones, and you lose estrogen so abruptly, and you lose half of your testosterone production too when you've taken someone's ovaries out. So HRT is very important for this lady, probably.
In terms of, sorry, pardon me, Elaine, in terms of questions there, we're saying, you know, it's just you can go to your GP and ask, because a lot of the symptoms you're talking about there, especially for women within their 40s, women are having babies so much later now that when you list those symptoms, they're like post-pregnancy symptoms that your body is readjusting after having your children. So you could tick every single box there and go, well, hang on my perimenopausal. So is it as easy as going and having a chat with your GP, or do you need to go and speak to a gynae? Like, what's the best, you know, for women to go and have a chat?
I'd start with your general practitioner, and they often know you best. And you're looking for a trend of something usually, and it usually, you know, it evolves over time. So the postpartum period eventually settles for most women, but whereas perimenopause won't.
Actually, Sheila says, how long does menopause last for? I'm 5 years into it. I still have very bad insomnia, night sweats, hot flushes, you name it, I'm at my wit's end.
I know. I mean, average we think is about 5 to 7 years for having hot flushes. Anything between sort of 15 and 20% of women will have what are called vasomotor symptoms, which is the medical term for hot flushes and night sweats for the rest of their lives. And the knock-on effect of that potentially is on their sleep and their ability to function during the day as a consequence, their concentration, their memory, all of that stuff.
Oh, and listen, just talk to your GP if you're suffering. There's absolutely no need to be going through any of this, and that's the thing. And yes, people are afraid. There's been so much misinformation about HRT, but for the love of God, talk to somebody, because we have enough to be going through in life without having to do
And
this.
as I said, as you move through the age of like you're 30 and you're thinking about starting families and then having your family and then the change of your bodies, it is just as simple as going and having a chat, and we say it out loud, it helps.
It's like my chat the other day, and all my bloods are numb. I'm starting my new regime on Monday, and I can't wait. I'm going to be a new woman.
We have such good intervention that's so helpful. We've loads of ways of helping women, and the benefit when it comes to HRT outweighs the risk for the majority of women.
Brilliant.
Anyway, thank you so much once again. I'm sure we'll have you back, because we haven't got through half our questions. And a quick reminder that if you have any medical questions, always seek advice from your pharmacist or your GP.
Now, after the break, we've even more summer holiday styles over on our catwalk.